Welcome to the Grow Strong Leaders podcast. I'm your host, Meredith Bell, and I interview business leaders who are committed to their own growth and the development of everyone on their team. If you enjoy my podcast, be sure to subscribe and rate it on your favorite podcast platform. Thank you for joining me today. I'm your host, Meredith Bell, and one of my great joys is having this platform to introduce you, my audience, to people who are really committed to their own development and also to the development and helping others reach their full potential. And I am so excited today because my guest, Hillary Miller, has been focused on doing this throughout her whole career. She and I discovered in our very first conversation that we share this passion for helping others connect with each other and elevate them to their highest level. And also our morning ritual, including coffee as being a mandate for us, was another fun common ground that we discovered. So Hillary Miller, I want to welcome you to my show.
Oh, thank you so much, Meredith. And yes, there is no morning for me that does not have a fun, festive cup of coffee. Coffee brings me ultimate joy and helps me start my day.
Well, you know, it's interesting you say that. One of my two business partners, Denny Coates, told me years ago, and I've never forgotten it, without coffee, I feel like a mere mortal. And I thought,
I like that.
I know that's so true for me. If I don't have my morning cup of coffee, I'm a little bit foggy. So I've had my coffee. I'm ready to go with our conversation. And I want to give a shout out before we jump in to our mutual friend and colleague, Kim Lone Tran, because she's the one who introduced us. And Kim is fabulous. She's going to be a guest on my podcast here in one of the coming episodes. And so want to thank her so much for this connection. And Hillary, I want to just share a little bit too with my audience. Hillary is the Chief Learning Officer at Penn State Health. And she's been there now a little over a year. She's going to talk to us about her journey there. She's also worked in several other healthcare systems during her career. And so she has this wonderful years of experience that she's bringing to this position. And I just love the things that she's doing. And I know you, as my listeners, will enjoy this too. So Hillary, let's dive in by having you talk a little bit about your journey in this learning and development space. Where did you start and what's happened along the way?
Yeah, so my career really started in public education, so special education, reading intervention, and being a teacher was my greatest joy. But I also found quickly that those skills transcend into it's really not industry specific, so you can hop into an industry. But healthcare happened for me really in my career with the Medical University of South Carolina. And I took a leap of faith. I hadn't worked in healthcare before, said, hey, I can do this. There's a lot of things I need to learn. And throughout that, my path has been everything but linear. I've dabbled in a myriad of spaces, whether that's an electronic healthcare record deployment, different tools and systems, quality assurance, everything on the revenue cycle side of healthcare to the clinical side of healthcare. And so my arrival with Penn State Health is really a culmination of all those experiences now wrapped into a healthcare system that's still evolving and growing and has all of those things with it, in addition to academic institution and the College of Medicine. And so it has all this beautiful blend of all of the things that I thoroughly enjoy, but also my past has allowed me to be prepared to come into that because I have worked in each of those things throughout my career.
Mm-hmm. Yeah, that makes you uniquely qualified to be able to talk to people in those various areas, and they know because you can speak their language that you get them. One of the things that I loved that you did when you first, came on board with Penn State Health is you didn't just automatically jump into put in programs that you had experienced in the past. You embarked on what you called a listening tour. And I would love for you to talk about what was that and what caused you, first of all, to decide that was the best approach to finding out what was needed. And then what did you learn in the process?
Yeah, it's a great question. So one, I think you learn these things through not doing them and the repercussions of that. And so for anybody who's listening, I think it's really helpful to know that a lot of the things that I do now were learned through failure points. And so from each career point I've taken, that didn't go well. I need to work on that piece going into this next job. And that's helped me in a myriad of ways. But with the listening tour, really what that is, and the set of questions matters as long as they're simple, but it's more of going out with people. So identifying key stakeholders across the organization, that doesn't necessarily have to be just executive. That is getting with individuals who work in the day-to-day. Your frontline managers, the executives obviously are a key part of that, but really it was just to say, hi, I'm here. What are your expectations of me? Because that had already been set in people's minds of, oh, we have a chief learning officer coming in. Here's what I expect that role to do. So I needed to uncover that with individuals, but also if you had a magic wand and could fix one thing, what would that be? What does learning and development look like for you? Is that an investment or is it an expense? And that mindset, uncovering those mindsets, the belief systems, the perceptions are so critically important to the work. And so that exercise helped me not only to know what I was coming into, what folks had access to currently, but also what those definitions were in their mind, because the perception component is a really powerful piece in any workspace, not just learning and development, but you have to know where people are coming from. Culture is already there. So you have to understand the culture that's already there. And then there's subcultures at each of the hospitals. And so it allowed me to say, oh, this person hasn't had a good experience with learning. Help me understand that. Or this piece or program has been amazing. Great. Why do you say that? And so I met with hundreds of people. My OneNote was exploding. And it's a lot of work, and you have to spend a lot of time and energy in doing that. But where that's ultimately rewarding is not only the connection points within your immediate team who's providing those services, it's connecting the dots of all the teams that might have like work across the organization. And so coming in and making quick moves could make sense. It depends on the situation. In this instance, that would have been detrimental. And so I spent time with my immediate team saying, what does the work look like? What are your processes? How do you want to communicate? And we kind of drafted a kind of guiding principles internally for us. But the listening tour really, for me, was comprised of 4 questions. And essentially, it's the magic wand question. What are your expectations of me coming into this role? What does learning and growth look like for you? And then do you see this as an investment or do you see it as an expense? And that was very telling for me. So when I started to formulate a plan, create governance councils, include work teams from across the organization, I had that information walking into those spaces so that I wasn't starting off on the wrong foot. And candor is really important to me. So I appreciated the time to be able to do that. I actually told my boss when I came in, hey, you're not going to see much from me the first 90 days because I need to be out with the people.
And that was okay.
Yeah. I think when you set the intention of what that means, people actually appreciate that you're not telling them, you're asking them. And that's a very important approach because it's a sense of curiosity to say, hey, I'm new here. I don't know all the things. Tell me about it. What does that look like from your lens? And it's also a great way to start the relationship building process early.
Mm-hmm. I'd love for you to talk in more detail about your own team because, my listeners are people who manage teams like you do or lead teams. Some are business owners that manage or lead everyone in the company. And so what are some things you learned and have learned to do that work well to build a strong, cohesive team where everyone, supports each other and really want to give their very best efforts.
Yeah, well, I'm really proud of this because in a year's time, my immediate core team, these are my direct reports, have relationships not only with me, but with each other. And we have a space where we can disagree respectfully. I think that's very important within a team that you have those expectations and parameters of what healthy dialogue looks like. But when I first came into the organization, we had teams that were sitting under different places. And so that's where I made a quick decision to say organizational development and some of the learning program teams need to be together. So I brought those underneath me because they work in tandem. And it's not like there was immediate harmony. They're all great individuals, but we had to establish that. And what that means is you have to spend time with people. So my team gets 50% of my time all the time because their work is a projection of really the services that we provide, and they're owed that with me. And that doesn't mean that I'm knee deep in the details of the work. We've set up frameworks where they're leading their efforts, but I have a strong stipulation. One-on-ones can't go any longer than 2 weeks. We have to have, you have the option of having weekly or every other week with me. You can have a half an hour, and that agenda is theirs to set. It's their meeting with me. And then we have a non-negotiable weekly meeting. And that weekly meeting is where we are looking at our strategy. What are the business goals? How is the work that we're doing aligning to that? Where do we have a barrier? And then development sessions. This is my favorite part because this is where you really stem and foster innovation and curiosity. We spend 30 minutes a week. I tell people it's so short, but we have focused topics, and I'm not driving those. Initially, I did to get that started, and we went through everything from aligning to a book to having topics that are relevant within the learning and organizational development community. And now it's become to where my team is like, we're not canceling these. They move their meetings around that session because it's become such an exciting part. And we do them on Fridays. It's a great way to end the week for them. And they can immediately apply the things that we're doing back into their work. So I'll give you one quick example is when we first started these 30-minute sessions, my team was like, that's not long enough. I said, oh, let me show you how power-packed 30 minutes can be if we have a structure. And so we have a Teams chat channel that we use in between. And we started with going through really just best practices and evidence-informed pathways, going back to Gagne and Knowles, and what are the things that are commonly used and how are you using that today? And that really stemmed us into going into books like Map It by Kathy Moore, lean processes, how do we have better surveys? And so over the course of a year, our team has had exposure to so many things that have helped them better connect across the organization, not only in their communications, their frameworks, their documentation. And it's been really beautiful to watch. And so I don't necessarily have to be in those every week, but I so enjoy them because I get to listen to things that they're growing in. And we have questions at the end. You have to tell me what you learned. And what are you going to do with it? So what's one thing you can take away today? And again, 30 minutes a week.
Mm-hmm. I want to go a little deeper with that because that's so fascinating. Number one, how do you respond when somebody says, we've got too much on our plates? My people can't find time. I can't find time for 30 minutes a week for that kind of meeting. How do you respond to that?
Yeah, so we had that in the beginning. And so what I went back to is, what are you working on now? What's the risk if we don't have this session? Are you willing to extend trust in the beginning? But that tied into the expectation. So when you don't have a plan that you're working towards, and you don't have clear line of sight of how your work aligns to key organizational indicators, that can make it really tricky. And then you tend to take on everything. And we had to renegotiate really how we work with the organization. That was a game changer in their time management because now it was, oh, my work's aligned. We have a team meeting on every Tuesday. From that team meeting on Tuesday, everybody has line of sight into what's happening across our team. They can ask questions. So by the time we got to the Friday, they have responsibility in mapping out their week. And it hasn't been an issue since. Sometimes we'll have a class that interrupts that session, which is 100% okay. But on the whole, it's 95% attendance on a weekly basis.
That's great. One of the other things that I was thinking about in listening to you, especially for people that are coming together, as a new team, as they did a year ago, and there may be concerns about being comfortable, feeling safe, being open and honest, having genuine dialogues, being concerned about having conflict with someone else. How did you address that and help them work to healthy interactions?
Yeah, well, I had to get to know each of them as individuals. That matters so much. And that's where that one-on-one time, in addition to the team time, that those two dynamics play off of each other. So the individual time was the time to build trust, but I had to be really consistent in my actions to build trust. So didn't cancel meetings, spent more time listening than I did talking, asking people to tell me about themselves. What are the things that bring you joy in your work? What makes you take this process? How are you thinking about this? And so more of putting the ball in the individual's court to tell me about them. And we were able to align individuals to the right work where they were maximizing the skill sets that they have, not being a jack of all trades. And that made a big difference. And we did go through I've had a bunch of leaders, I don't trust you yet. And I'm like, fair. That's fair. What does trust look like for you? That definition might be different for me. What does that look like for you? So I spent a lot of time clarifying, saying, what's your definition of that? I don't know that we're on the same page that way. And by doing that, it allowed us to have open dialogue, work through stories. We spent a lot of time with the Crucial Conversations platform on mastering dialogue because we don't really ever arrive. It's a constant practice. And I told them, I'm going to mess up. Here's the thing. I will never criticize you in public. We'll talk about it privately. And some folks have some baggage with that if I've had a really bad experience. So now every time there's a like situation, I'm reverting back to that bad experience. And I had to say, but is it true? And they go, nope. And I say, great. So now what do we want to do? And so the conversations that I have, we talk about work. Mostly we talk about their growth and how they're applying information and how they're thinking about something. That to me is worth its weight in gold because it allows me to understand how each individual operates, how I can lean into them on a personal level, but while also managing the things at a team level. But it's we've had our ups and downs, but it's certainly once folks establish trust with you, that's a game changer.
It's so true. And the fact that you brought up that need to be consistent, I think that speaks volumes because it's all about integrity, doing what you say you'll do. And people are watching to see, is she really going to do this? And then that belief when they see it and the trust just kind of forms naturally. And I know that at this point you are excited about expanding these development meetings to other parts of the organization. So talk about that process. How will you make that happen, knowing what it took for you to develop that with your own team? How will you help other leaders bring those same kinds of conversations to their
team? One thing about this, it's such a great question, thank you, is everything does not need to be scaled. Just because it worked in one piece does not mean you can automatically scale it across. So I do things in increments. So grab a couple leaders, say, hey, you mentioned you want to work on development, be a part of our pilot program. I like to pilot and test a lot because we can make adjustments within that. And so I'm meeting with some team members this week to talk through how they can deploy this within their own departments. own it, run it collectively, have guiding principles within their own teams that they've crafted together, really their commitments, but not thinking that it has to look exactly like this, run exactly in this way. No, you craft that with your team. I didn't come in saying, hey, we're going to meet in this way every single time. I said, we need cadence and we need consistency. Let's build a plan together and let's figure out what each meeting is for, because they're not for the same thing. And so when you're talking about development, that is not to go through your work list. It is to help them see how that information applies back to the work that they're doing. We do not sit and talk about work projects only if it ties to what we're actually developing in that moment. So when we were working on surveys, it made a whole lot of sense to bring in survey drafts of what we were already using to work through that in real time together to say, I see the difference here. We actually made adjustments. But with other teams, it's breaking down that trust is the first question I'll ask. What's the level of trust within the team? Because if you don't spend the time there first, a development session is just going to be seen as another thing you've added to my list. That's where trust is a game changer, because if you're committed to saying this is for our development, here's our rules of engagement. But if you haven't established trust, haven't brought them into the conversation, a development session could go sideways very quickly.
Yeah, I think to me, what you're referring to there is the leader having clarity for themselves about the purpose of these.
Yeah.
And I like this idea of testing, piloting, where you've got some people that are raising their hand and saying, I'm ready for the next thing to do to up level performance and engagement, whatever terms you want to use, for my team and those they serve. And I'm curious, with going back to your listening tour for a minute, what were some of the things that you learned that you are now incorporating into, let's say, your leadership development programs or any other employee programs? What were some things you identified needed to be addressed? And then how are you developing programs to incorporate those?
Oh, I love this question. Two things immediately pop into my mind. One is voice. You never asked us what we needed. You created something and deployed it, and we were never asked or included in it. That's huge. So that was number one. That's why we started the governance councils, to have representation from across the organization. That was a fundamental game changer for us. Number two is empowerment. So thinking that a learning or growth or development has to happen through someone else. And so we had these conversations with leaders throughout the year, not relying just on our team to do these things. Let us help you with the tools and pathways that you can do today, not thinking that learning and organizational development only happens from this team. It's actually the underbelly and foundation of the organization. And that can be as simple as how you connect with people, how you run your meetings. Clarity is kindness. Brene Brown says this all the time. The kindest thing that we can do is have clarity. But also in thinking that it's got to be perfect rolling out of the gate. And I tell folks, nothing I do is perfect. It is more of the exercise of actually doing it and then being consistent in that. And so the voice and the empowerment, really, really huge. And those are things that fundamentally we'll have to work throughout. But the voice piece, when I heard time and time again in my meetings with stakeholders, is that this team that was the driving perception. You never included us. And I said, great, we're going to change that right now. And so the Learning Council started out as very organic, random folks from across the organization. And in all honesty, when we first started, people are like, why am I here? Why do I need to listen to these things? Now it's people reaching out and saying, gosh, can we be a part of that? I'm like, of course you can. And it's helped us to develop a relationship, not only in service to the organization, but to say, hey, we want to work transparently with you. So if we're working on a program and you have something similar, let's make sure we're connecting so we're not duplicating effort. But two, administratively, logistically, there are some things that need to be managed from a chief learning office. That's actually in service to the organization, so you can do the things you do best. It also helped us to uncover some gaps in efficiency. And so when you have a highly matrixed organization, you have to know how to play with others. Clarity of roles. What do I actually do in my department versus yours? And those take time, but councils and governance meetings are a great way to set those expectations and to have clarity in here's the handoffs, here's the timeline, here's how we're working with you. A very good example is really with our annual requirements in healthcare. We are a highly regulated environment. So there are components within training that have to happen. It's not a question of whether we can do them or whether somebody likes them. We have to do them to be compliant with CMS and the Joint Commission, because we get audited, as we should, because we're taking care of people. And so when it comes to those practices, bringing those core teams together to say, how do we do this in a way that's successful for the organization, is user-friendly, helps people to adapt and adopt, but also is a good use of their time. And so in a lot of the listening tours, what came out also in that voice piece was, I don't have time to go do this, but what they were really saying is it wasn't valuable. And so we just kept uncovering, what do you mean? Why wasn't it valuable? Why did you see it as a waste of time? And so all these bad experiences in their mind created this perception of, I'm not going to sign up and register for things unless you make me do them, because it wasn't valuable. So we took that to heart and said, oh, okay, we're listening. Work with us.
It sounds like this council has really changed from a, trying to convince people of its value to it in itself. It's so compelling now that people want to be a part of it. What is it that's happening that's causing people to want to be a part of this?
Well, some of that is when you're trying to foster or create or rebrand a relationship. Part of it was just for that alone, is to say, here's what we do. I don't think we have a shared understanding of the services we provide. That was the initial reason for that. But two, it was to say, we have multiple hospitals that have their own culture that, share most of their work, but there's a big difference between a academic medical center and a community hospital. The services are different. The level of illness for a patient could be different. And so spending the time to say, do we have the right people involved? And again, we had really low attendance in the beginning, and we knew that. And I told my team, stick through it. If we're consistent with this and we keep asking the questions and we keep engaging, this will turn around. By golly, it did. And now people are sharing what they're doing locally with us because they're seeing the value of that connection point. We don't want to come in and own everything. We do need to know about it so that we can create a shared narrative. So if we're talking about patient safety in one hospital, is that narrative completely different in the other? Mm-hmm. In a lot of ways, it shouldn't be. And saying, what does a learning and organizational development team do? We didn't have a strong definition around organizational development. People heard that and they go, what do you do? And so we had to outline that really in services. How do you connect with us? Who are the people? And now my team is just so proud of their work. I think they've always been proud of their work, but expectations and clarity go a long way because now people know how to engage with us. This is the work that you do. We expanded the portfolio significantly. So it's not just learning programs. Work that we do is consultation. We go out to teams that are having trust issues or team building issues. We might work directly with the leader. We might work directly with the team as a whole. And then student programming. We are a healthcare center that is tied to a lot of academic institutions across the Commonwealth of Pennsylvania. Those relationships are so critical, not only to future employment, but to cultivating the love and passion in health sciences, in information technology, in administrative. There's so many things to a healthcare system that anybody from the outside may not know. It isn't just clinical staff that makes a healthcare system run. We have nutrition services, environmental services that help keep our patients safe through hygiene. So all of those things are very exciting to me because it isn't just one role. And that's where a learning council matters, because you need representation from each of those areas to say, this is what it looks like for us and where we're missing the mark in programming. Really key win, we identified that we have 24-hour staff. They were being asked to, the night shift was always being asked to come in and take day shift training. I said, gosh. So we're working through that right now to have offerings that meet both populations so that we're not asking somebody who works third shift to stay over or to come at a time when they're normally sleeping. We want to stay on the schedule that works for you. And so that's one of the wins that has come out of that council.
That's so great. There's so many nuggets there that anyone can, listening, could really adapt for their own organizations. This idea of a council of people cross-sectional that can learn from each other because they have preconceptions about some of these different departments or perceptions that they've, created over time, and this ability to really learn from each other is phenomenal. I want to go back to something you've said a couple of times that I love, which is saying, I'm not perfect. I think that too many leaders are afraid of acknowledging that for fear of losing respect or their authority or something like that. And yet it's so easy for you to say that. And I'm sure to be that way. And I'm just curious, what had to happen in your own development to get to the point where it's easy for you to say, I'm not perfect, and you don't feel like it's threatening to your position to...
Oh, if I could just tell you all of the things that I had to learn through, in a lot of ways, very painful. When you first start out in leadership, you're like, I know everything. I can do everything. I have to show up as this perfect person. That's exhausting, number one. I didn't realize how exhausted I was early in my career when I started to get into formal leadership, of having to have this front of like, I know everything. Number two, people already know you don't. So it makes it just that much easier because they're already well aware of your expertise. So when I go in and talk with teams, I ingest a little bit. I'll joke around and say, shocking, I'm not an expert in this. And they'll go, whew. And it's okay. I'm okay with that. We all bring a different layer of services, support, past history. And it also helps your teams to be okay. That's when you go back to like psychological safety, which can feel pretty nebulous sometimes. Psychological safety is that we can readily admit mistakes. It doesn't mean that we want mistakes to continuously happen, but that matters in the learning environment, because when you feel super exposed and vulnerable and then we shut it down, that person is likely to not say something again. Rather than, I'll say it in a meeting, ooh, I messed this one up big time. And I save my apologies for where it matters. So I use a lot of language of thank you so much for understanding the shift in the schedule. I don't apologize for that. It's actually not something I could control, but I'm aware of the impact that it has on somebody else, versus I made a mistake. I made that decision. I am so sorry that impacted you in that way. What can we do to make this better? And even with my team, I've had to work with them to say, why are you beating yourself up on this? How would you have known? And they go, I couldn't. I said, great, let's lift that weight off of our chest. But we go through the Byron Katie work, which is fantastic. And I always ask them, is that true? And they'll go, no. And I'm like, well, if you can't confirm it, you take that out of your brain and let it go. Because now you're stewing. Yeah, you're stewing and creating a story, and that stinks.
When you had mentioned that earlier, of course, Byron Katie immediately came to mind because she's famous for that. Is that true?
Yeah.
And then, can you be certain that that's true? Just challenge you a little bit further. You're bringing up such a good point that people, especially folks, I think, that go into these helping and caring professions, are very responsible people. and they take on more responsibility than sometimes is apt for them. I think back to Scott Peck's book, The Road Less Traveled. He was a psychiatrist who worked with two different groups. One group, he said, was very hard to get through to because they didn't take responsibility for anything. They blamed everyone else. The other group took on too much responsibility, and he found them easier to help let go of. What you were just saying, how it lifts the burden off of them to go through those questions that help them realize I couldn't have done anything, or I did the best I could in that situation. So it sounds like you're probably dealing more with that second group of people in your work, the kind of folks that are attracted to healthcare work, who really do care about.
Oh, I love our healthcare workers. And again, that's clinical, non-clinical. We are in the business of human beings. And you can love that all day long, but there is a lot to that. Safety and quality are so critical to what we do, but also, and it's been front and center, when we talk about what is well-being, well-being in my mind isn't all of the exercising and hydrating and going and getting massages. Those things are all wonderful. And I highly, highly recommend people do those. But it's also, have we made processes easier for you to do your job so you can actually do your work? Have we committed to listening to what's a barrier for you? Have we empowered you at your level to make real change? Because I don't know your day-to-day work. I'm not working in that. And that's where I see the ultimate responsibility of anybody sitting in a formal leadership seat who has responsibility in overseeing strategy work, frontline leadership work, whatever that looks like. It's not about us being right. It is about uncovering what is the right thing. And that takes some ego checks. That takes the, I don't know what this means. Can you help me understand? And if people judge that, that's outside of my span of control. Well, only thing I can control is how I show up into a conversation and my own behavior. And so if we each could do that, can you imagine the power that we'd have with teams? But what tends to get in the way is sometimes there's a confidence issue there. You've been burned in the past with saying something, and now you've moved into silence because of it. So the human condition is complicated, but I think the more that we can showcase of, I have no idea, that'll be the first thing that comes out of my mouth is, I have no idea. I'm not even sure I know what that means. Can we talk more about that? Can we go research it with you? It's allowed other people to have a breath of fresh air to say, oh, I didn't know that either. And I'm like, great, let's figure it out. What do we need to know here? I was not always that way. That was a really scary thing for me. And I had to work through that on my own through making some fundamentally bad mistakes, but also how much weight has been lifted off of me as a person to not feel like I have to be great in all these things. So perfectionism, you have to be aware of the shadow sides of that. Perfectionism can be great because you're fully committed, you're paying attention to the details. Where that's super detrimental is that when it becomes all you can focus on, and I delay getting something out because I have to have the perfect draft. We call them sloppy copies in our team. What's the sloppy copy of this? And that was super uncomfortable for a couple of my team members because they're like, oh, it looks so bad. I'm like, I don't care how it looks right now. I care about the context. Let's get the context right. Then we can talk about the content, and then we can talk about the design. And that really has helped them to say, oh, here's my sloppy copy. I'm like, awesome.
Well, you know what else you're introducing there, Hillary, that I love is humor. It can make things fun. There's a lightness to it. This is coming from someone who tends to take things seriously. So this is an important learning that I've had too. If you can lighten things up by helping people laugh or, see the joy, the benefit of doing sloppy copy versus trying to get it so perfect the very first time, it allows, to me, greater creativity to flow because they're not stressed. They're not having these heavy emotions that would cause restriction or constriction of the creative side of us. Do you find that too?
Yeah, well, and I think for me, one thing I would position in this conversation is humor is not the reduction of expectations. Humor is upholding expectations and inserting that in the right places. So laughter is really healing. And when you have a team that you can laugh with and it can be 5 minutes worth, boy, does that change things throughout your day. It's also an outstanding stress relief. So thank you for recognizing that in me. Humor is a staple for me as a person. Integrity is high up there, but anybody who knows me personally knows that humor is a key part of just how I'm built. And you have to know the appropriate places for that. But boy, I think laughter matters so much.
It sure does. Hillary, this has been such a great conversation. I'm curious if there's something that I have not asked you about related to whether it's the listening tour, what you learned from that, what you're doing now, how to help people connect with each other, anything else you'd like to add before we wrap up?
Yeah, become a sharer. So if there's anything that I could say as a call to action among the learning community is shared, because just because it worked in your organization doesn't mean that somebody's going to steal it and make it work magically in theirs. We're all going through the same things across industry. This is not specific to healthcare. So I share a lot of things. And if that's going to help another group be successful, I'm all for it because I've learned from someone else. None of this is really novel. It's more of what does that mean within your culture, but also give yourself grace in the process. It's hard work. You have to have a level of commitment. You have to have frameworks on the days that are really hard to say, yep, this is a really hard day. I don't feel successful. This hasn't been great. And be able to pick yourself back up the next day. I do not deny my emotions, but I do recognize them and own them while I'm in the moment to say, not my best self today, and be able to work through that. So that would be my feedback to anybody that's listening is you have got to give yourself grace in this process. People are not thinking about things nearly as much as you think they are. So, clarity, kindness, connect with people doesn't necessarily have to mean agreement all the time, but those things matter because leadership is hard work. It's important work. It's powerful work. And you can't create more leaders if you can't do these things for yourself. So thank you for asking that. I appreciate it.
Oh, thank you. There was so much packed in there. Just that one response there to me would be worth somebody really pondering and thinking about how can I apply all of those nuggets in my own life, because there's a lot of richness there. Hillary, you have so much that you bring to the table. Penn State Health is so lucky to have you, I think, because of who you are as a learner, who you are as a leader. You're really magnificent.
Oh, that's so kind. Thank you. You just made my day. I'll try not to get red in the face.
Because there are so many truly brilliant things that you've said around leadership this morning and around how you show up and what that does when you're open, honest, and vulnerable with others in terms of building that trust. And of course, the bottom line is we want results. We want to see positive consequences and outcomes as a result of whatever work that we're doing. And so I just want to acknowledge everything that you have brought to your position here and how you are enriching the lives of others.
Thank you.
So thank you for being with me today and for this conversation. And I am really looking forward to staying in touch and seeing and hearing about all the wonderful things you're doing.
Meredith, thank you so much. And if anyone wants to reach out to me or you feel like I could be of help to you, find me on LinkedIn. I really do check my messages. I post things pretty often. Love seeing the things that others are posting. So don't hesitate to connect with me there.
Oh, great. I'm so glad you added that because that was my last question is how can people connect with you and learn more about your work? So LinkedIn is the best place for them to do that.
It is.
Great. Thanks again, Hillary. It's just been a joy talking with you today.
Thank you, Meredith.
Thanks for tuning in to my podcast. Now head over to growstrongleaders.com and check out our 2 books, Connect with Your Team and Peer Coaching Made Simple. While you're there, download the free Facilitator Guide to find out how to implement our unique peer coaching system. Until next time, I'm Meredith Bell.